continuing to work on my studies of death and dying and obesity, but another area of interest I have is on how family roles and relationships affect health. And this is a really exciting area to study because everybody has families and those families affect their health. And there was this kind of classic assumption in sociological literature for a very long time that said marriage made us healthy. And in fact, marriage does make people kind of healthy, having two sources of income, having someone to love and support you and remind you to eat your green vegetables every day. It really does help to enhance health. But there's newer research, including some of the research I'm doing, that shows that not all marriage is good marriage. And someone who's in a distressing marriage might actually have poorer health than someone who is single and quite happy. I just wrote a paper that looks to see whether the effects of divorce on marriage are affected by what was happening in the marriage, and really trying to get at this question, is it better to get rid of a problematic spouse or to keep them? And we find that in some cases getting rid of a problematic spouse really helps people's health. And one reason why, and this was a really surprising finding to me, is that a fair number of marriages end because the spouse that kind of triggered the divorce had a substance abuse problem or drank regularly. It means one can imagine being married to a problem drinker causes a lot of stress. In some cases, it causes even a non-drinker to start drinking, either to be sociable or to adjust to what could be a really difficult marriage. So there are many cases whereby divorce isn't necessarily bad for the adult, and in some cases even the child, if it means that one is leaving a bad marriage. So really thinking about the way our relationships, and specifically healthy relationships, affects our physical and mental health is a really exciting area of research.